When we talk about addiction and mental health, it's almost like we're having two completely separate conversations. But what if they're not separate at all? What if they're actually two sides of the very same coin? Today, we're going to dive into a new way of thinking that sees them as deeply connected and explore how treating them together could honestly change everything.
So let's just start with a really big, kind of provocative question. What if the entire system we've built to help people is, well, fundamentally flawed? It's a tough thought for sure, but it's right at the heart of understanding why so many people struggle to find a recovery that actually lasts.
Okay, let's put a number on this so you can see the sheer scale of the problem. According to the National Institute on Drug Abuse, nearly half, think about that, almost 50% of all people who have a mental illness will also have a substance use disorder at some point. And guess what? It goes the other way too. This isn't just a small overlap, it's a massive intersection.
Now, to really talk about this, we need to use the right language. The clinical term is co-occurring disorders. You might also hear it called a dual diagnosis. And just giving it a name is a huge deal. It's an acknowledgement that this is a distinct, combined challenge. It's not just two separate problems that happen to land on the same person by bad luck.
So why is this connection so incredibly strong? Well, it is definitely not a coincidence. There's a deep, two-way street here. First off, on a biological level, the reward and stress pathways in our brains are involved in both conditions. Then you've got common psychological roots, like trauma and stress. A lot of people start using substances to try and self-medicate the symptoms of an untreated mental health issue, but the irony is that substance use can then trigger or make the mental health condition way worse. It's just this incredibly powerful and vicious feedback loop.
So if we know these things are so tightly linked, you'd think our treatment system would, reflect that, right? But historically, that just hasn't been the case. And that brings us right to the core of the problem, a broken system built on what's called fragmented care.
And here's what that looks like in a nutshell. Over on one side, you have the traditional addiction clinics. They're focused on detox, on abstinence. But their huge blind spot, they often completely miss the underlying psychological reasons a person is using in the first place. Then, on the other side, you've got mental health care. They're focused on therapy and meds for specific diagnosis, but they often don't properly factor in how substance use is affecting everything. You see the problem? Each side is only seeing half the person.
This analogy just hits the nail on the head. Imagine having a condition that affects both your heart and your lungs, and you go to a heart doctor and a lung doctor, but they're in different buildings and they never ever talk to each other. It sounds completely absurd, right? But that is exactly how we've been approaching co-occurring disorders. It's a model that is so obviously flawed, and it puts all the pressure on the patient to try and connect the dots themselves.
And what happens because of this disconnect? Well, the most obvious result is incomplete treatment. And that leads directly to a much higher risk of relapse, because the condition that isn't being treated almost always triggers the other one. This constant cycle of failure just piles on the stigma and can cause people to give up and disengage completely. And from a pure systems point of view, it is a wildly inefficient way to use our healthcare resources. This approach isn't just ineffective, it can be actively harmful.
Okay, so we've laid out the problem pretty clearly. But now, here's the turning point. Let's talk about the solution. This is where we see a huge shift in thinking, moving away from that broken, fragmented model to a comprehensive, holistic framework.
The answer is something called integrative care, and it's basically a coordinated approach that treats the whole person, not just a list of symptoms in isolation. The most important words here are simultaneously and patient-centered. It's all about tearing down the walls between those two separate buildings we talked about and creating one single, cohesive plan for the person right in front of you.
And this isn't just some vague, feel-good idea. It is a very structured process. It all kicks off with a truly comprehensive assessment. Looking at everything: mental health, substance use, physical health, social situation. From there, a single integrated plan is created. The care itself is trauma-informed, which is absolutely critical since trauma is so often a root cause. The whole approach is recovery-oriented, focused on long-term wellness, not just a quick fix. And finally, it brings in family, social supports, and is culturally competent, really respecting where the patient comes from. It's a true 360-degree view of care.
So, a great framework on paper is one thing, but does it actually, work in the real world? Let's take a look at the actual benefits and the impact it's having.
The benefits are, well, they're incredibly clear. First and foremost, patient outcomes get better across the board. We're talking lower symptom severity, people staying in treatment longer, and most importantly, much lower relapse rates. And you know what? It's actually more cost-effective. By treating the whole person right from the start, you cut down on all those expensive emergency room visits and hospital stays later on. And just as important, treating these conditions together helps smash the stigma. It reframes the whole conversation away from being about a moral failure and towards what it is, a complex, treatable health condition.
The data is powerful, for sure, but it's the personal stories that make it all real. The source material talks about a woman named Angela who was struggling with both alcohol use and anxiety. After going through a program that integrated both, she said this, and that quote, it just captures the whole point, doesn't it? It's not just about stopping a behavior, it's about building a life that feels fulfilling.
And listen, this isn't just happening in a few small experimental programs. We're seeing huge systems prove that this model works. The Veterans Affairs Whole Health Program is a perfect example. It's a massive program designed to provide this exact kind of comprehensive, patient-centered care. This proves that integrative care isn't just some nice idea. It can be done and done successfully on a very large scale.
So, if this approach is so much more effective, what's stopping it from just becoming the standard of care everywhere? That's the big question. Let's look at the path forward and the challenges ahead. And the challenges are definitely significant. Our healthcare systems are literally built in these separate silos, and changing that structure is hard. There are huge training gaps. Providers are usually experts in one area or the other, but rarely both. Then there's the money. The way things are funded and reimbursed just isn't set up for integrated services. And honestly, sometimes it's just plain old resistance to change. Overcoming decades of "this is how we've always done it" is a huge battle in any industry, but especially in healthcare.
And this really brings us to the final, ultimate takeaway. We have made such great strides in getting people to agree that mental health is health, that it's just as important as physical health. But if we really truly believe that, then shouldn't our system of care be whole, too? It needs to be integrated, comprehensive, and designed from the ground up to treat the whole person. That's the real path forward.